So as you probably can tell, I'm pretty passionate about this disease, but not everyone shares my opinion. And that's okay, because differing opinions are important, and you need to understand all the different perspectives if you're really gonna understand a topic or be educated about it. So that's what we're gonna talk about a little bit today. There's a movement that's like health at any size, and then there's the food is medicine movement. And these are two pretty important movements today, and they don't agree with me, which is okay. I think they're wrong, of course. But that's the great thing about America, is everybody's entitled to their opinion. And we just need to figure out how to talk together and figure out how we can best help people, because that's what we're really here for. Dr. Evan, I've been doing this for 20 years, and this is pediatric care or childhood obesity care. That's what I've been doing. It's what I spent basically my entire career focused on, and why I feel so passionate about this topic. And hopefully I'm opening some minds and some hearts so that others can get the help and care that they need and the support that they need. So first, how do you really talk about obesity properly? And you may have noticed I talk about obesity as a disease, right? Because I've said it's a disease and not a lifestyle choice. So people have obesity or develop obesity. They're not obese. Obese is an adjective that describes a person that has really become pejorative, meaning demeaning at this point in narrative, right? So it's not something we should be using. So we actually don't even talk about any disease process as an adjective anymore. We've learned that it's called patient first language. The patient first, child with a gallbladder problem, adult with diabetes, not, diabetic adult or, cholecystitis child. So even just changing the way we talk about things and the language we use can go a long way, which sort of is why the health at any size movement bugs me a little bit. I totally support their overall contention that people should be able to choose what they want to do with their bodies and their health. And it is actually true that you can be healthy at a larger size. I did a video with a couple of my patients that was on an Australian news magazine, and they included somebody from that health at every size movement to talk about the differing opinion. And she runs marathons and does ballroom dancing and super active and does all these things, and her numbers in metabolic health are all great. And so she says and argues that she should be allowed to live her life in the size body that she has. Totally agree. And she's healthy, so that's great. But if she weren't exercising so much and watching what she ate, she probably wouldn't be. And so what I would ask her to understand is that she's chosen to treat her obesity with diet and exercise, and it has worked for her in terms of metabolic health, although it hasn't worked for her in terms of weight. And I would never shame her or criticize her opinion. Yet the health at every size movement sometimes criticizes people who want to get medication or who want to get surgery. And they say it's the medical industry that's pushing people to do this, and our culture of being skinny that's pushing people to do this. And maybe there's some truth to that, but it's you as the individual. If you feel like you want to be healthier, and when you get healthier, you get smaller, that's okay. Like, why should any of us criticize what anybody else wants to do with their lives or their bodies or their health? So that's my big issue with them, really. But, again, she's entitled to her opinion, and she is healthy at her size. And if you want to be healthy at a big size, you do you. I'm not here to tell anybody what they should do. I'm just here to give information and help people who want obesity treatment in forms that are generally more effective, like medications or surgery. There's this other group that's the food is medicine group. That's a big political hot topic right now because, again, policymakers would rather talk about diet and exercise than they would about obesity treatments. They want to tell you that chronic diseases can be treated just by diet alone. And again, there are certain diseases where dietary changes can help a lot. Think about gluten intolerance or lactose intolerance. Those diseases get better if you eat differently. But obesity is not one of those. And the way they sort of couch it makes it seen that food can be medicine for all diseases. So again, it's more of the same diet and exercise stuff. And while that worked for the health at every size advocate and can work for some people, it just doesn't work for the most of us. So it's kind of disingenuous or almost deceitful for the government to put more and more money into diet and exercise without putting any money into things that have been proven to work better. So, basically, where do we go from here, right? The AAP, or the American Academy of Pediatrics, otherwise known as AAP, has recommended obesity treatment for children as young as 12 years old with medications and surgery as young as 13 years old. So how do we make that happen for people? Because that's really what we need to do as a nation, as a society, to help people with obesity, not just to help them, but to help society as a whole and to help the future generations not suffer from the same amount of obesity as we do now. And that's our topic for next time. It's a little bit deep, but hopefully you like what you're hearing. Hopefully you've been posting in comments all along. Hopefully you've subscribed. Hopefully you've been liking or disliking the different videos. Hopefully you're telling me what you want to hear next. Hopefully you're sharing this with other people. And hopefully you're sharing with people who don't even have obesity so that they can learn how to help in a little bit of a different way. So tell them to tune in next time, because you're going to tune in next time, and we'll talk more.